Doctors of Reddit, what was the craziest case of patient paranoia that you have ever seen? My father was a doctor, dermatologist. Had a patient who accused him of prescribing a non-existent experimental drug for a supposed condition that he was never diagnosed with. Tried to take him to court and lost. Sent a threatening letter after, reported to police. After the police confronted him about it, he dropped a homemade fruit basket with a single bullet on top of the fruit at the front step of the office addressed, but not postmarked, to my father with a creepy unsigned apology note. Basket was immediately shown to police. About a month later my father received a letter from the guy stating he had seen my name in the paper sports section, local golf tournament results, and that he knew I would be playing at an upcoming tournament, where the start times were published. There was a police presence at the tournament, something that never happens, because my father reported it. My dad's nurse's husband was a local detective and pretty much followed me the whole day with my dad. The police found the guy in the parking lot unarmed, and he was arrested, then eventually committed to a psych hospital for some time. There's still a restraining order against him to this day, but this was over 15 years ago, and the guy seems to have disappeared. I didn't know any of this until about 5 years ago, but I remember my dad having a single bullet in his bedside table, even though he never owned any guns. When I asked him about it, all he would say was someone gave it to me. Former psych nurse here. I once had a patient who believed he was Satan. Since Satan was nude, so was he. He spent much of his time in a private secure room, and when it was time to go for some fresh air around the unit, we had to bargain with him to wear a robe. Not a doctor, but my grandfather had Lewy body dementia. Unlike other dementia, Lewy body has a strong hallucination component. Here are a few of my favorites. My grandma was having an affair with the pharmacist. She was also running a whorehouse, which would be okay, but she wouldn't give him a cut. The shadow men had built an exact replica of his house, but on wheels, to use as a brothel, naturally, and were stealing his electricity to power it. That's why his switches, which powered outlets, would flip and nothing would happen. They had also dug in a basement under his house, which he attempted to access one night by cutting a hole in the floor with an axe. If he took anyone looking for this alternate house, they would move it to make him look crazy. The staff at the care home he eventually was placed in was treating all the food with embalming fluid, so he couldn't eat it. He also had another doctor tell him that the medications he was on were us poisoning him, and that he didn't need to take them anymore. It was a roller coaster. Not a doctor, but I work with elderly people prone to delirium. We once had an 80-year-old academic at our institute. I think he was some sort of professor and obviously well spoken. Also mostly appeared to be very lucid at first glance. For months, he'd harbored the idea that he was at the center of an elaborate ritual conducted by a medieval sort of witch. Because of her spells, he would constantly phase in and out of consciousness, imagining to smoke a pipe and talk to people that weren't there at all, etc. He further claimed that he had found that there were pentagrams drawn in lemon juice and goat urine all over his apartment. His mouth was constantly deathly dry because she would fill it with the ashes of cursed scrolls and parchment. The witch planned to extract something from his body to create a flying ointment or something for her broomstick. Anyways, it was absolutely wild and nonsensical. The crazy thing was, his delusions turned out to be warranted. It was later found that his granddaughter for months had actually tried to poison him with incrementally increasing doses of belladonna extract. Student nurse here, but I still go to the hospital for internships. Had a patient come to the ER with really high blood sugar, type 2 diabetic. I asked her if she was taking her medications, and she said that she didn't want to. Thinking she was referring to some type of bad side effect, I asked her what medication she was taking, and it was diabetes. Chlorpropamide for those of you who aren't Brazilian. Pretty standard 2 medication, not a lot of bad side effects other than some skin rashes. I asked her why she wasn't taking the pills, and she said, look at the name. I can't take something that has diabo, devil in Portuguese, in the title. If I have to go, I shall go without any contact with these devilish chemicals, like the Lord intended. It was hard not to laugh at that one, but I kept my shit together. Psych nurse. Had a patient that thought that the queen was a lizard person who swapped his penis with another one. Also had a patient who thought we were drugging the air through the vents. Oh, and someone who thought his cat was spying / stalking him for Trump. Not a doctor, but I scribed for one. A patient of ours was having hallucinations, where a helicopter was chasing him. He'd randomly hear helicopter sounds throughout the day, and felt like he was being spied on. Turns out he was ingesting too many edibles, and smoking too much weed. Once he cut down, the paranoia stopped. Not a doctor, but I used to go to a nursing home to visit with people. I had an elderly lady call me her grandchild. That wasn't uncommon even for those who were completely lucid. I had many grandmas and grandpas, and she was my favorite. She was very sweet and funny. She seemed to only have the occasional lapse of memory, at least that's what I thought. One day I was in her room watering her flowers. She asked me how I really was. I said fine, but she then whispered, I don't think they can hear us, unless there's some device in the flowers brought. I was confused, but said nope, I'm fine. She loudly said my real name, and that she was happy to see me. Then she grabbed my arm, and pulled me in, and called me Anna, not my name, and said she could get me safe. Then went on this whole thing about them capturing me, and bleaching my skin. Now she was black, I'm white. She asked if my skin was burning, and not to worry, because I wasn't patchy, so I could pass for a white woman, and that I could still get a husband. She was worried about my children, which I didn't have any. She gave me crackers, because she was worried that I didn't have food. I don't know if she had been stockpiling them for a reason, but they were the kind they occasionally got with dinner. I honestly didn't know how to respond. I was 15 and very confused. I think I smiled and tried to tell her I was safe. It was a very weird and sad at the same time. I'm not sure what she went through in life, so it could have been some kind of memory. Anyway, after that day she would occasionally call me Anna, give me crackers, and ask if I was safe. Most of the time she would call me by my real name, until about 6 months before she passed, and then she really didn't recognize me at all. Not a doctor, but I worked for a luxury watch company doing repairs. One client was 100% certain that we installed a tracking device in her watch, came back repeatedly to have it removed, and got the police involved. It was actually really sad to see how delusional this woman was. We don't want to track you, and let me tell you, there is no room for anything other than the movement in a watch case. Surgical nurse here had a patient return to the, or who had some hardware, plates, and screws put in their elbow for a fracture. The hardware was causing them discomfort, so instead of talking to her surgeon they decided to try and remove one of the screws with a knife and screwdriver. I got the case for the wound cleanup and replacement of said exposed screw. One of the strangest ones I've had yet. A blig, not a doctor, but one of my close family members is. A lady came in with her infant, 0 to 12 months, indicating that the government was going to take her baby away if said infant didn't get the heart surgery the baby needed, because they would think she was neglecting it. She had visible signs of self-inflicted injury, and I forget the name of it, but the one where people rip out clumps of their own hair and eat it. My family member treated the baby. When I say treated, I mean they did the rundown on the baby and verified that it was in good health. Social workers were called with respect to whether there were any orders out or issues regarding the welfare of the kid, and nothing. The kid wasn't on anyone's radar for social services or any of that. Then things get interesting. Police show up. Husband had called the police and said wife was acting erratically on the phone, but when he got home, she and baby were not there. I gather police protocol normally involves checking hospital admissions, so people get found quickly. Wife subsequently failed, both with officers and physicians present, to correctly identify day of the week and current location. I'm gonna omit the whole after story, but the end of the story is just that a couple months later, husband, baby, and wife/mother are all happy/healthy, and it's about as positive of an ending as an acute mental health incident can have, given the circumstances. I'm a nurse scribe. The most paranoid patients I've seen are the ones who are very high on meth. Usually it involves them believing that bugs are crawling on or out of their skin. Don't do meth or heroin. Those drugs are bad and catch. Edit. Oh, I forgot. There was another meth patient who decided to take out his teeth with a butter knife. He partially succeeded. Paramedic. Had a guy refuse an EKG for his 10/10 left-sided crushing chest pain because they caused heart attacks. When I asked him why he thought that, he said all of his friends who died of heart attacks had one, and that he was wise to our EKG conspiracy to give people heart disease and raise money for Big Pharma. IQ nurse. We had an elderly woman with some kind of schizophrenia. My mental health knowledge is shocking, and she had subdural hematoma, facial fractures, fractured clavicle, dislocated shoulder, all of her fingers were broken, huge burns to her hands, stable L5-6 fracture, some kind of fracture, dislocation to her ankle, burns and open wounds that required suturing all over. It appeared from the injuries that she was significantly assaulted, but no, she did it all to herself. Not really paranoia, but delusion or dementia. My mum used to work in the office on a psychiatric ward. One of the patients would come to the office window every single day, ask for a bus ticket, and pay for it with a penny toffee. They would pass him a raffle ticket and he would spend the rest of the day sat on a bench in the reception area waiting for a bus. Every night after he went to sleep, the staff would put the penny toffee back on his bedside table. I always thought it was really sweet of them to keep up the charade.